Good morning, everyone, and welcome to the Bay Area Council's weekly webinar on COVID-19 and all related issues. I want to welcome our guest speakers, particularly Representative Jackie Speier. Her time is limited with us, so we're going to lead off with her. As you know, Representative Speier represents the 14th District of California, which is southern San Francisco and most of San Mateo counties. She serves on the Armed Services Committee and the influential, obviously, Intelligence Committee. She's got limited time, so I'm going to have her lead off, give us a quick update from Washington, D.C., what's been happening and what we can expect in the weeks and months ahead. Thank you, Representative Speier.
Thank you, and I really would appreciate another opportunity to talk with you at another time when we could spend a good hour together. I'm taking time away from a caucus call right now to speak with you, so I'm going to get dinged for being tardy to that particular call, but you'll be a good excuse. Let me just say how important it is during this time that we stay connected, and I will be meeting, for instance, this afternoon by Zoom with the tourist industry in San Francisco and San Mateo counties, another hard-hit industry. I know that from the Bay Area Council's perspective, there's a great interest in wanting to make sure that the SBA loans will be available to 501c4s and 501c6s. We're still negotiating that at this time, and I will have an update for you after I have a conversation with the speaker, hopefully later today. As you know, the Sba Loan Participation has been extraordinary. They have now burned through, and I mean that in a positive sense, $350 billion in the PPP program, a Paycheck Protection Plan, and the EIDL loans that were also available that are disaster loans have also been exhausted. To put it in perspective, they have over 1.3 million loans through the PPP program and average amount of $240,000. The EIDL applications are about 4 million and $380 billion in requested funds. So as you can see, the need for an expansion of these programs is real. There was an interest in extending it for another $250 billion. Frankly, I think we need to make it more than that. $250 billion isn't going to come close. The speaker is attempting to make sure that half of that money is set aside for small businesses, micro businesses. We have no way of knowing who has actually benefited from the program so far. Are they just the mega companies, or are they many of the mom and pops and Main Street businesses? The other thing that I'm very alarmed by, and I tweeted about yesterday, is the fact that for some reason, Texas has received over $1 billion more in SBA loans than California, and over 30,000 more loans than California. And yet California, obviously a much bigger state by population, and more than $1 trillion more in economic prowess. So I am crafting a letter now that hopefully all the members of the California delegation will sign to the SBA, asking for an explanation for why it is that California appears to have gotten shorted in the applications that have been processed. I wouldn't want to say this is political, but it certainly brings out the cynicism in me.
Thank you so much, Congresswoman Speier, and please send our apologies to the speaker for dragging you away from the caucus meeting. I think we may have time for one or two quick questions. First of all, just on behalf of the Bay Area Council, a 501c4, thank you so much for your advocacy on our behalf for the next iteration of the SBA loans. These will be critical for our ongoing fiscal health and operations, so we appreciate that greatly. Any questions coming in from panelists? Please, just by housekeeping rules, there's a Q&A box at the bottom of your screen. If you have questions, please load them up there and we will get them to you. But I know we have a very limited time with with the representative. So please ask quickly. I will, if take the liberty of asking the first one. Obviously, the return to work when normality returns is as Governor Newsom describes it, a dimmer switch, not an off-on switch. Can you give us maybe a little bit of a projection from DC on what sort of timelines we may be looking at?
You know, it's going to be different across the country. And I think we're going to see it happening in smaller universes. So you might not have the entire state open up. You might have a segment of the state or certain functions within a state opening up first, and then gradually more and more. I don't think that we can expect that we will return to normalcy as we knew it pre-COVID-19. Until we have a vaccine, the new normal is going to be very different. Excuse me, that was not a dry cough. And so I think that, for instance, I'm really concerned about our restaurant industry because there is not going to be the opportunity to have the tables closely aligned, which means you're going to reduce the number of staff and the number of chefs and the amount of income. I think that we are not going to be in any position to be full on open for business until we have a much more comprehensive testing protocol in place. We have tested in this country about 1% of the population. It is an abomination. It is such a dereliction of duty, leadership, and responsibility. So that has to be beefed up considerably. Contact tracing has got to be improved. And of course, we've got to develop the treatments. So it's going to be a slow process. It is now expected, thanks to our sheltering in place or staying at home, that the peak in California is going to be late in May or even in June. And the good news there is that we're prepared in terms of the bed space. There's ample bed space, I think, in terms of ventilators. I think that is going to be probably sufficient. And the problem becomes then staffing. Our biggest area of potential hotspots are going to be in nursing homes and among the homeless. There is really a lack of regulation of nursing homes at the state level. And so, for instance, board and care facilities that have 6 persons or less housed in them are not regulated at all. Now, in San Mateo County, there is a consortium of all of the providers, but it's done on an ad hoc basis. It's also done voluntarily, and they're providing additional training and counseling to those that are providing the services in these facilities. Most of those who work in nursing facilities are not healthcare professionals. Maybe they're LVNs, but many of them are low-wage workers. Many of them become very fearful when there's a breakout in their particular facility and don't even want to go to work. So we're stepping in there as well. So that's where we've got to put the emphasis now across the state.
Well, if you have time, Congresswoman, for one more, someone who I'm sure you know, an old colleague of yours, Mike Conneran at Hanson Bridget, is asking, in the next round of stimulus funding, will there be assistance for local government in that package?
You sure have, not going to get my vote unless there is more funding for local governments and hospitals. And that's partly what the Speaker is trying to negotiate right now. Mitch McConnell wants to do a flat $250 billion for small businesses. We know that our local governments are in great pain right now, fiscally, and we know our hospitals are really stretched to the limit. The first funding for hospitals went out based on Medicare, and so the hospitals that need it the most are those that provide Medicaid services, and they have yet to see even the first tranche of money. So yes, there will be more money for local government. The question is, what do we do about those communities with less than 50,000 population? And there's about 11,000 of those cities in the United States, a lot of them, frankly, in San Mateo County as well. So we need to make sure there's going to be funding for those cities that have less than 50,000, but also make sure that there's increased funding for local governments generally. Before I close, let me please suggest that we have another session where I can be on the phone with you. I can invite the district director of the Small Business Administration to join me. She did a town hall with me 2 weeks ago. So for your members who may have questions about the loans and how they can go about accessing the next tranche of money, I'd like to be able to assist you in that.
Oh, absolutely. We'll work with your staff and get that on the calendar today.
Okay, great.
The kind offer. And thank you for your time. And again, please give our apologies to Speaker Pelosi for hogging so much of it.
Okay. All right. Thank you.
Bye-bye.
Stay well, stay home.
Thank you. You too.
All right.
So next, I want to do quick housekeeping rules, which we probably should have done at the outset. All of you who are participating in the call are not on video. We just have your audio, and you are muted. So if you have questions, please use the Q&A box at the bottom, and I will collate and facilitate those. Next up in our lineup of speakers is someone who, like our previous speaker, needs no introduction, but I'll do it regardless. Phil Ting, he's the former assessor recorder of San Francisco, and he's now the assembly member for the 19th Assembly District. He chairs two really important committees / caucuses that are relevant to us as a region. He chairs the Assembly Budget Committee, and up until a month ago, he oversaw perhaps the largest budget surplus in California history, the largest rainy day fund collected in California history, and hopefully we'll get a little update on the status of both of those things. But he also chairs the Bay Area Caucus, and for those of you who are members of the Bay Area Council, you know that that's a caucus that's incredibly important to us as an organization. And as Congresswoman Speier just said, at the federal level, we may be missing out on dollars for political reasons. Well, that also happens in California from time to time when we do battle with our good friends from Southern California for formulas and appropriations, and Phil leads the charge on making sure we get our fair share of those dollars. So I want to introduce Phil Ting, our Assembly member for the 19th District, and to give us an update from the state of California on COVID-19. Thank you so much for joining us.
We appreciate that. Also, just thanks entirely to the Bay Area Council. It's been a great partnership with our Bay Area Caucus, working together on so many issues like Regional Measure 3. I know before we recess, we're also working on further transportation and housing issues. Those have been absolutely top of mind for most of the Bay Area legislators. Just to give everybody a quick update, Matt led into it just where we are fiscally. When we started in January, we still had over $21 billion surplus or reserve. We like to call it reserve because the surplus makes it sound like we have that money to spend. We were saving it for the next recession, which we kept talking about. I've been talking about for the last 3 or 4 years. We didn't think at all that the recession was going to come this way, but luckily California is much better prepared than we were in 2008 when we were sitting on a reserve of about $1 to $2 billion. So our state budget right now is over $200 billion. We have a general fund of about $147 billion. So even though we have a $21 billion surplus, it goes rather quickly. The governor's identified about $7 billion of it to spend for COVID-19. However, he feels the majority of it can be reimbursed by FEMA. He's identified spending actually from the state at about $1.5 to $2 billion. So we'll still have a certain amount of surplus to deal with this very tough economic situation we have in our state. A couple of big issues. One, we know that hospitals have really been at the forefront. We are so lucky in San Francisco, but also in the Bay Area, to have amazing healthcare, amazing hospitals that have really stepped up and working the front lines. I'm lucky that one of the hospitals that was suffering in my district in Daly City, Seton, got a lifeline through funding from the state to open up about 200 beds. the old CPMC hospital that is closed because the new CPMC is now moved to Van Ness. That hospital is moving up online and going to be online. It's going to be serviced, my understanding, through Dignity Health as well as through Kaiser. In addition, UCSF is also looking at bringing back online their Mount Zion Hospital facility, which they had, again, shut down because they'd moved everything to Mission Bay. But again, with the need that we're seeing, that hospital may potentially come online. And we're acutely aware that hospitals, while they're busy and full, are suffering financially because the services that make money in terms of selective procedures and surgeries are not able to do. So we are fully aware of that and also very sensitive that we need a very robust healthcare system to really get us through the next 12 to 18 months. As all of us have been watching Dr. Fauci talk about, things really won't return to normal, as the Congresswoman said, until we have a vaccine. So even if we're allowed to open, go back to work, it's still going to be very challenging given the fact that we're still going to need to do a certain amount of social distancing. We may not all be able to physically be at work together. I know at the Capitol in Sacramento, our offices are all rather small. So I imagine that we're going to only be allowed to have a certain number of staff in our offices with us because we can't do the 6 feet of social distancing. In addition, I know that transportation projects continue. I've worked to ask Caltrans to expedite some of the Bay Area projects that have been planned. So again, the carpool lane extension around 101, Caltrans did move up the 101-280 interchange, which is planned for July. So they're going to be working on that at the end of April, which is great because we want to get that work underway before people go back to work. The last thing we want is for people to go back to work and then have Caltrans start working on our freeways. In addition, I know that many people are focused on EDD and unemployment benefits. We now have 2.8 million people who've applied for unemployment benefits since mid-March. And just to give you a scale, we went from about 2,000 a day to now 2.8 million people total. We now have ramped up EDD. They are open from 8 a.m. to 8 p.m. Their phone lines are open. That's going to start in about a day or two. EDD is also ramping up their ability to accept self-employed applications. That's been a feature that they weren't able to do. They're going to be able to start doing that April 28th. And they'll be able to hopefully turn around those applications in about 48 hours. Right now, the traditional EDD lag time is about 3 weeks. So they're shortening that for this self-employed program. Also, just in terms of DMV, just a quick note, there are automatic extensions for people who have licenses who are under 70, automatic extensions until May 31st. And so that's the high-level state update. Just in terms of just, COVID-19 numbers for the state, the numbers that we tend to focus on are, as of yesterday, we do have now 821 fatalities. We have 1,175 cases that are confirmed in ICU, plus another 375 ICU cases that aren't confirmed, but they suspect it is COVID. And when we say we suspect, maybe the test came out negative, maybe they show all the symptoms, but for whatever reason, the testing did not completely confirm that. So they suspect it is, but they can't put it in the completely confirmed category because of the testing. So I'll just stop there. Really look forward to everybody's questions. And again, thanks everybody for jumping on this Zoom call.
Thank you, Assemblymember. That's a lot of great information, and we're getting some very good questions. And first, I think we would be remiss if we didn't thank you and the whole family of public employees in Sacramento who have essentially kept us safe. As everyone knows, California has led the nation in our COVID-19 response, and it's in large part due to our, probably in total part due to the courage of our elected officials and the greater family of public employees who are going to work every day and and doing what you do to keep us safe. So thank you so much for that work. First question, I think, is from Pat Mappelli at Granite Rock Construction. Obviously, as you know, the whole construction industry was in a bit of a funk before COVID-19, and long term, it has really not recovered from the 07-08 recession in terms of getting people back to work. The labor pool has never really recovered. In terms of getting California back to work post-COVID, have you given thought to maybe putting construction at the front of the line so that we don't lose any more of those critical construction workers, and we can get back to building, and particularly on the housing front, but not exclusively?
Yeah, I think it's a great question. I know we're all eager to get everybody back to work. That's first and foremost. Right now, we are following all the public health officials. Who knew that every county's public health officer would now become the most popular person, frankly, in the state. And so while I know I would love nothing for me to get back to work and for my kids to get back to school, we are listening to their guidance about really what should be done and what can be done with proper social distancing. So again, we know for certain Caltrans projects, we're going to try to take advantage of the empty roads and try to do the construction, because usually that transportation construction is really rather disruptive. So we are trying to expedite that as much as possible. There are jurisdictions that have allowed housing construction, especially housing that is affordable. I have a letter that I'm sending with Senator Wiener, as well as a bunch of my other colleagues, to just really further clarify to make sure that housing construction, especially for those that are constructing affordable housing, can continue and can be very, very consistent. You and I know, Matt, that we had a housing shortage before. We are going to have a housing shortage after this. And if we don't build more housing, it will continue to get worse. So absolutely, that's something that we want to continue to focus on. If we weren't talking about COVID-19, we'd be talking about homelessness and housing. Those issues still remain top of mind. And in terms of just the budget for 1 second, we are going to be passing a budget on June 15th. For all of you wondering what else might go into that budget on June 15th, chances are it'll be similar to what the city's doing in San Francisco, where it'll be a continuing budget of this year's budget with a couple additions around COVID-19, around homelessness, as well as maybe around wildfire mitigation. The horrifying thought is we're going to start getting into wildfire season again, and people are at home. So we are very concerned about those three issues, and we're very focused on those three issues. And then what we'll do is probably in August, when we have a better revenue picture, which is when taxes get paid on July 15th because of the delay, we'll know whether we can add more money to the budget, or we may actually have to do budget cuts by then.
Thank you. So I want to introduce our final speaker, Supervisor Susan Ellenberg from Santa Clara County. And the supervisor, she represents the 4th District in Santa Clara, which is sort of the heart of Silicon Valley, West San Jose, Campbell, Santa Clara. She chairs actually the very critical healthcare committee for Santa Clara County, which is obviously a very important subject. And we also share the great distinction of being first 5 commissioners. She's a champion for families and children as well. So I'm going to hand it over to Supervisor Ellenberg to give us the local perspective. But before I do that, I want to give a big shout out to her staff. In the last couple of weeks, they've been incredibly helpful in getting clarification for our members who move ahead with critical construction projects, and been able to get turnarounds on clarity for those projects, internet update, data centers, telecommunications, and the like. And it's been very, very, very great working with her office on that. So I wanted to make sure her staff get a good shout out in front of the boss. So turning it over now to Supervisor Ellenberg to give us the local perspective from Santa Clara.
Thank you so much for highlighting the work of my staff. They really have just been stepping up in every direction every day, and I'm glad that you made that very public as well. Just a quick clarification on committees. I'm the chair of the Public Safety and Justice Committee and the vice chair for Health and Hospital right now. And as you mentioned, the chair of the First 5 Commission for Santa Clara County. Let me thank you again, Matt, you and your team, for the invitation to speak today. And I want to say on behalf of my colleagues and our public health officials to all of the members, thank you. California generally and the Bay Area specifically has stepped up and stayed home. That has saved lives, as our curve does appear to be flattening here, and it's saving lives around the nation as we've been able to provide some supplies to spots around the country that are actually hotter than we are. And we know that this comes at an enormous cost to so many businesses and lives. So for this sacrifice, though it wasn't necessarily one you took on voluntarily, thank you. It is truly not lost on us. And to those twin ends of saving lives now and mitigating the monumental sacrifices of our residents, I want to discuss a few items that have come out just over the past few days. And then, of course, I'm happy to answer questions about anything that I don't address that you want to hear about. On Tuesday, Governor Newsom outlined 6 critical indicators that we must address before we begin reopening the economy. And Assemblymember Ting, I really appreciate your emphasis on the fact that it's the public health officers who are really running the show right now. Santa Clara County as well is following the direction of our public health officer. We are encouraged by the science and the data-centric approaches that the state has taken and is taking, and we stand ready to work with the governor at the local level to see our economy opened up in a smart, effective manner as is safely possible, ideally in the coming months. Continued partnership between the state and local governments in the coordination of this response will really be critical, as counties and cities will be charged to implement those state guidelines. And resources into the field in real time to serve our residents in our hospitals, testing centers, labs, and public health response teams. However, there is a role for every county to play on behalf of its own local residents, considerations that may be county specific depending on the demographics, the industries, and other institutional structures. Last Thursday, I authored an op-ed in the Mercury News discussing principles and a strategy for a local reopening here in Santa Clara County. First, and I can't emphasize it enough, any reopening in the Bay Area will take place in the manner in which we entered this shelter in place, collaboratively. Dr. Sarah Cody, our public health director, has been working with her colleagues in Alameda, Contra Costa, Marin, Sonoma, San Mateo, and San Francisco to ensure that all public health orders being given will have the largest possible impact by making them regional in nature as opposed to county by county. And I know that this is a principle that all of you here at the Bay Area Council wholeheartedly support. Second, at our board meeting on April 2nd, Dr. Cody updated the board on the 4 points that we need to see here before we turn the corner on this epidemic and start to see some reopening. The first is that the hospitals must be able to safely serve everyone in the Bay Area. We must have not only adequate beds and medical supplies for patients, but also sufficient personal protective equipment for our frontline healthcare workers. Second, and Congresswoman Speier alluded to this, texting kits must be broadly available to everyone with symptoms and for those at a higher risk, such as patients and staff in nursing homes or other congregate settings and unhoused. Third, systems must be in place for robust case investigation, rapid isolation, and contact tracing. This essentially is the bread and butter for public health for finding and stopping cases before the outbreaks flare up. Fourth, health officers must see a sustained reduction in cases for at least 2 weeks, which we've come to recognize as the incubation period of the coronavirus. And this point can't be stressed enough either. We all want to see an easing of the shelter-in-place orders, but we won't see that, and frankly, we shouldn't see it until these trends begin to be seen. At this point, there are promising signs that our growth in cases is stabilizing, but we are not out of the woods yet, and we need to continue to maintain physical distancing in order to drive down transmission. As a supervisor, my primary role during this crisis is and will continue to be ensuring that our public health officer and her colleagues have the resources financial and otherwise, to meet these goals and ultimately defeat the virus. But just as these orders save lives, so does planning ahead. We will see the day, and hopefully not too long from now, when we will begin easing the current restrictions and reopening sectors of our economy. So let's be forward-thinking enough to start discussing that now. On Tuesday, this coming Tuesday, I will be asking my board colleagues to adopt a referral that I've authored to put together a task force of local thought leaders to begin discussing what a reopening of the economy and our society may look like. The task force, as I'm proposing, would be made up of 23 members and would include only 3 elected officials. The other 20 members would represent the best economic minds in our county's 3 world-leading universities, leaders from organized labor and business, our nonprofits and faith communities, the K-12 education system, and others. COVID-19 is a major health threat. In fact, a once-in-a-century one. But illness from contracting the virus is not the only public health threat that it poses. Long-standing health crises like mental illness and suicide, poverty, under and uninsured status, lack of exercise, and poor management of chronic disease, amongst others, are also potential health threats heightened by coronavirus and the shelters in place and the accompanying job losses that have resulted. Our public health officer has highlighted that we must strike a balance between reducing deaths and illness due to COVID-19 while also working to minimize the harms of our interventions. We simply should not ask our public health officers to weigh all of this alone, especially when the full weight of the immediate epidemiological and healthcare crisis responses are falling so heavily on them. The expertise and leadership of our private and educational sectors can assist in these times to paint a fuller picture of this crisis, as well as help to craft a path forward, and we should ask, and I am asking, for their engagement and support. I look forward to a continued conversation with the Bay Area Council and your members on this and other topics, beginning with your questions today, but let me leave you with this. The Bay Area led the nation in issuing a shelter-in-place order on March 16th, exactly 1 month ago. It is working, the curve is flattening, and all of us need to continue to work together to finish that job. And I'm confident that then, through our partnerships, we will also lead the nation in opening up in a way that saves lives and jobs. The crisis has been unprecedented in so many ways, with far-reaching effects. And it is our role right now to address those. I'm grateful myself to be in a position where I can work to have impact and engage with my community and look for opportunities and ways to mitigate and ease the tensions and the impacts to the greatest extent possible. And I'd be delighted to take any of your questions.
Thank you, Supervisor. That was a very robust update. And we have over 150 members of the Bay Area business community on the call. So would like to volunteer our services on your Economic Recovery Committee and Reopening Committee, however that's constituted. Please feel free to call upon us to participate in that, and we'd be very happy to volunteer.
Thank you.
So I've got some questions. I'm going to direct this one first at, it applies to both of you, but I'll go to Assemblymember Ting first. Obviously, our public transportation networks have been deeply impacted by the shutdown. There's no fare box recovery going on to speak of. Are you looking at funding mechanisms to maybe to prop up and save our public transportation systems at the state and local levels? So start with you, Phil.
Yeah, I think that's a great question. The federal stimulus package or the series of bills did have some money for the different public transit agencies. I think the challenge for us at the state level is transportation is primarily funded through special funds. So for example, a lot of our transportation dollars comes from gas tax funding, as well as different bond programs, or the high-speed rail program is funded through our greenhouse gas reduction fund. So there's not really a lot of flexible general fund money. The other reason why we have a difficult time, say, doing a stimulus at the state level is we don't have the ability to borrow. We can borrow through bonding or through issuing bonds, but obviously that takes a certain amount of time. We have to pass a balanced budget every year. We're going to pass a balanced budget on June 15th. But that also means at a time when we're losing revenue and people need more government services than ever, the time that it's also harder for us to put money into things that are needed, such as transportation. So while we'd like to make sure we can fund more public transit, it is very difficult at the state level to figure out how we go ahead and do that.
Thanks, Phil. Supervisor.
So, you know, to be honest, the transportation is not a primary function of county government. Our board chair is also the chair of VTA. We have another representative from my board who sit on the VTA board. But what we're looking at are really some of the incidental challenges that are associated with public transit, and of course, that's the increased transmission, and it's having folks who are unhoused. Really needing indoor places to stay, and at times that ends up being on our buses. We've tried to do some coordination between VTA and the shelters to actually have bus drivers take folks to shelters or spots where they might be able to go and get services. There's a lot of work being done on cleaning and sanitizing. You may know that we shut down our light rail after a driver tested positive. The buses are running reduced routes, and it's as with everything else, it's a really delicate balance between helping people who are essential workers get where they need to be and trying to minimize transmission.
One issue all three of our guest speakers have raised today is housing and homelessness in particular. And that's, a crisis before COVID and will remain a crisis after COVID. And obviously it's impossible to shelter in place if you have no shelter. So it's critical that we not miss this opportunity and to use a hackneyed phrase, waste a good crisis to try and solve for this most pressing of problems. One solution that has been put forward, and some of our the hotel community in particular is participating in, are providing hotel rooms for first responders, emergency service workers, hospital workers, but also for folks in SROs who find it difficult to shelter in place or at least practice social distancing, and ultimately for people who are homeless.
Right.
But over the long term, we've run some numbers. In order to house a person in a hotel and feed them 3 times a day, it equates to essentially what a functional equivalent of building an accessory dwelling unit, a term Phil knows very well, being one of the champions for ADUs in the legislature. It's about a 3-month equivalency, hotel versus a permanent tiny home on dedicated land, which I think is a long-term solution to this problem. And so I'll turn this over to you, Phil, and I'm blindsiding you a little bit, I'm sure, but do you see an opportunity in this crisis maybe to address the homelessness issue through a greater adoption of accessory dwelling units or tiny homes?
I think we're definitely going to be working on homelessness. The question is how. I think we're so focused on the short term and getting people off the streets. I know that we put $150 million aside for homelessness and also to lease up hotel and motel rooms. But I totally agree with you. We have to figure out how we can get construction up and going so that people can get permanent housing, not just temporary housing. We have funded housing at a record level the last couple of years in terms of the state, over $1 billion for affordable housing. But one thing we didn't get done, we got a lot of good legislation done over the last couple of years. We didn't get a really robust supply side package through. We continue to get so much opposition from local governments, local cities. You mentioned the ADU bill that you and I worked on. That was really one of the only supply side victories that we had. So we know we have to do supply. We know we have to figure out how to go get it back up and going. The challenge is how do you do it safely within everything that we're telling everybody? Is there a way to get the construction going so that you can still operate 6 feet apart, perform the function very safely? You're not infecting large numbers of construction people in the industry. In terms of the state, we haven't discussed any specific financial proposal yet. All the proposals have been rather short term. I think if there are ideas, I think we're always open to doing it if there's a way to do it fast. I think right now we are up against speed. We have a 12-month to 18-month window where we really have to move very, very quickly. So that's why you're seeing us do things that we definitely wouldn't have, I mean, nobody would have thought about putting homeless people into hotel rooms 2 months ago. That just would have been a laughable sort of topic of discussion. But now with all these hotel rooms empty, it becomes something that we were seeing as a potential viable short-term option. Having said that, I don't think we should waste the opportunity to get back and try to still do legislation on housing. I know that we've been asked to really pare down our legislative packages, but the work that I am continuing to carry is really around housing and homelessness. So my housing bills that I'm looking at to try to make it cheaper, try to make it more predictable to build housing are all the bills that I'm still continuing to carry in Sacramento.
Thank you, Phil. And I saw the supervisor indicating a willingness to answer as well. Go ahead.
Sure, glad to answer that. And I really want to build on this notion, trite as it may be, of maximizing the value of a crisis. Certainly here in Santa Clara County, we are looking at a number of systems, whether it's housing our unhoused community members, looking at digital access. We're painfully aware of the challenge of students being able to engage in distance learning if they don't have access to the internet, telehealth medicine. I think that when we get back to what we are talking about as normal, I'm hoping that we will have a new higher base of normalcy where a lot of the practices that we are forced to confront right now serve as proof points that we can do this. We've been able to house every community member previously unhoused in our community who has tested positive for the virus. So we are utilizing a significant number of hotel rooms. We are expanding shelter hours. We're looking at tent encampments, and frankly, a lot of things that we were hesitant to step into very deeply are happening now out of necessity. And again, my hope is that we reset at a higher level than we were before.
Thank you. One question that just came in is on public-private partnerships. Obviously, they've been the unicorns of public policy, much discussed, very rarely seen. For both of you, again, we'll start with Assemblymember Ting. Do you see P3s being more prevalent in the future going forward, given the need for probably more private investment in a lot of the stuff the state could no longer, invest in?
I think that's still definitely an option. I know that we use P3s primarily around transportation. I don't get as involved in that because there's not a general fund expenditure. It's a special fund expenditure. But I know that there are definitely specific areas where it does make sense to partner, especially when we have to do things very, very quickly. As you know, oftentimes we have a fairly cumbersome contracting process, and it's difficult to actually move quickly, partly because there's so much scrutiny and there's so many rules and regulations, and there's so much at stake in terms of somebody getting a contract versus someone not. But I think it definitely does make sense to continue to work in public-private partnerships, and as we need to really leverage our dollars to build more, whether it's in transportation or in terms of housing, I think it makes a lot of sense.
Great, thank you.
A place that we're seeing significant public-private partnerships right now are first on the acquisition of medical supplies and equipment, rental assistance, small business assistant, in working with the Silicon Valley Community Foundation to bring together, we've been able to bring together government money from the county and the city of San Jose, from significant private donors, to really jumpstart the cash inflow that is needed here. Another opportunity that is slowly getting off the ground with a public-private partnership right now is how we can expand internet access to our neighborhoods that still don't have capacity. And again, this is another critical piece that we're working on right now. And I think going forward over the next several months and looking into years, that public-private is really going to be critical. The need is so significantly high, and so much of it needs to be delivered today, yesterday, quickly. And the private sector has some advantages there that government doesn't.
Thank you. So I don't think it's any great secret that going forward, there will be significantly fewer public dollars available for a lot of the social programs that there will be significantly higher demand for post-COVID. Obviously we're looking at, from societal perspectives, some pretty dark days ahead. Hopefully not, but the projections don't look great. I'll start with you, Supervisor. At the pointy end at the local government side, how do your budgets look in terms of service provision for those in your community that most need them?
So this is my greatest worry, and literally what is keeping me up at night right now. We have had a sustained budget growth, fortunately, over the last number of years, and have used that to expand and innovate and put into place a lot of programs to help broader swaths of our community. And as you said, revenue is going to be significantly depleted at the same time that need is significantly increased. We are moving our budget to a later cycle this year to give us a little bit more time to be able to analyze what the cost of COVID recovery and management has been to date, to get some models of projections of what it's going to look like over the next year or so as we recover. And actually something else that I'm working on, we're about a week ahead of where I am on this, is asking our county executive to look at the budget in a different way this year, if not activity-based, then certainly with a much greater breakdown, so that the five of us really have a clear understanding of what our county essential services are. How much does it cost to run those services? What are the trade-offs? I mean, you want to think that everything a county does is essential, or we have no business doing it. But even within that range of essential services, we're going to have to prioritize. And I'm painfully aware at how much this is going to put our really valuable nonprofit CBO partners, health clinics, in an extremely precarious position, as well as the increased number of folks who are going to need to depend on social services, many for the very first time.
Thank you. Assemblymember.
So for us, this is my fifth budget I'm working on at the state level. And the last 4 budgets that we have done, we've had a very heavy focus on spending on things that we considered one-time cost to get to exactly this moment. The ongoing commitments that we made, whether it was around Medi-Cal or CalWorks or CalFresh or to local schools, we were very intentional about what did we want to commit to in an ongoing way versus what did we want to commit to one time. So for example, anything that was deferred maintenance or construction, great one-time cost, because we could set aside the money over the last couple of years. We can start putting the money in the economy, or it's being put into the economy. So once we hit a recession, the best thing to do is to build. It's a time where you actually could get construction workers and you can get things done, and construction funding and financing have dried up. Where I'm most concerned is really around the K through 12 school system, because it's a system that we give money to, but we have no control over how they spend it. All the contracts are negotiated locally at the school boards. Everything is, in terms of spending, is all based on individual districts and how they want to have agreements with their teachers, their paraprofessionals. We've been concerned that many districts have not really planned for the future, don't really have a whole lot of money saved, and that is about half of our budget. So if we have to go and bail out different school districts, and again, you want to talk about the most excited group of people in the state, talk to any parent who has kids in schools, and you're going to get a lot of opinions, a lot of emotion. So we know that that's a major area of concern. Like the supervisor, I'm also very concerned about the folks who are most in need, who really need the most help, and we're not going to have quite the resources that we'd like to help with the people who are lowest income or working families. I know that's going to be a challenge. I know the governor yesterday talked about a population that really wasn't able to benefit in California, even from the stimulus package, even though they are working Californians. And that's a very significant undocumented immigrant population that is working, they pay taxes. And so we're setting up a separate program in California to really assist them with the help of many of our partners in the philanthropy world. So this is a major concern, but it's also why we've been pretty careful over the last couple of years. Just to give you examples, so if we had $10 billion to spend, we would traditionally spend about 75% of that on one-time costs and only really commit a quarter of that to ongoing, because those are programs that we did not want to have to turn off when the recession came.
Great, thank you. I think
Could I-
lessons learned.
Could I address a couple of things that the Assembly member said? Thank you so much, Bill, for those comments. And as a former school board member, I want to just reflect a couple of things. It's interesting that your perspective is that there's so much control at the local level, because through the local control funding formula, school districts are held, I think, properly very accountable to making sure that we are spending money. I still say we, it's in my heart, appropriately and on the students who need it most, in furtherance of equity. A couple of years ago, there was a legislation that actually mandated that school districts reduce their reserve cap, which certainly was a challenge, but it contributes now to it being a little bit more difficult. And frankly, schools are being asked to do so much more than educate. And I'm going to come back and would love your support, Assembly Member, on this digital equity piece, because as we expand and increase distance learning, and frankly see that this is a model that can work even post-COVID when necessary for students, we need to make sure that our cities are fully connected. We can raise private dollars truly to buy devices, Chromebooks, send them to kids, even phones to serve as mobile hotspots, but it's that real broadband connectivity that I think is just going to make a tremendous difference, and that's beyond the capacity of school districts to address, and I would love to be part of any work that you might be interested, Assembly Member, in doing in that direction.
No, happy to have that conversation. And again, we've been talking about it. Even if we can go back to school, going back to school is going to be looking very different than it looked in January. So,
absolutely. Agreed.
Again, we are all having to prepare for a very different world. Matt, many of your members probably were much better prepared. I know when I first started working, I used to work for Arthur Anderson, and they really pioneered a lot of the hoteling and working remotely, which it seems like more and more of us are going to be doing. So
that's actually a good segue into our final question. We've got 6 minutes left, and from Rochelle Swanson, who is Government Affairs for Cox Castle, a company that provides and builds a lot of our telecommunications infrastructure. If we are to be able to continue to work safely from our own homes, if we're to have equity in access to the internet, we're going to need more infrastructure. We're going to need more small cell. We're going to need more 5G. We're going to need more data centers. And a lot of these essential infrastructure projects are very difficult to get permitted, particularly at the local government level. Is there, again, in the essence of not wasting a good crisis, is there a way of going forward, making it much easier to build out this network, particularly for underserved communities?
Yeah, so that was a proposal we heard a couple of years ago in the legislature. It was there's a lot of local opposition because in order to streamline, just like around housing, we had almost every local government really stand up in opposition. So I think the industry hasn't really come back with a more moderate proposal that they could get some support around. I think it'd be an interesting time to go do it. But in terms of remote learning, we know that for sure we are going to have to most likely look at that issue and figure out how we breach that achievement gap. We know for so many folks, I know San Francisco Unified handed out, I think about 8,000 or 9,000 computers plus certain Comcast hotspots with that. So that's going to have to go hand in hand. We know even in LA Unified, for people who did have computers handed out, teachers still had trouble getting in touch with the students and getting in touch with the families even after they had the computers. So again, we know so much of how we're used to operating is kind of face-to-face. When you have to do it remotely and track people down when they're not in front of you, we know it's much, much harder. So it's something that we're going to have to grapple with. It's going to make it harder in terms of grappling with our achievement gap, but I know that we're going to have to do it.
So let me take that in two parts. First, the non-digital piece. The achievement, the opportunity gap is so much more directly related to socioeconomic status, access to early care, early childhood education, food and housing security and stability, than any kind of digital piece. And again, that's a place where I think that there's tremendous work for county governments as the safety net providers to be working with our school districts to help stabilize kids so that teachers actually can spend all of their time educating rather than remediating. And to the speaker, with regard to your question, thank you so much for that. I have been in conversations with the city of San Jose over what we can do really in the very short term to set up some more infrastructure, whether it's colts or flower pots, and reach these underserved neighborhoods. There's some issues, of course, still with the small cell rates, and there's a case right now in the Ninth Circuit that we're waiting for a decision on. I think that arguments were heard in early February, but this to me is an opportunity, and whether we're looking at the urgency of telehealth or distance learning for students or even the contact tracing that we need, I feel that this is really the moment to go big and to go all in with cities and with unincorporated areas of counties to get that infrastructure up, get carrier equipment hung on it, and really address this problem now. So thank you for that. And if you want to follow up with me offline, I'd be happy to have further conversation.
Great. Well, thank you. We're almost at time, and I do owe Rochelle an apology. It's Crown Castle, not Cox Castle, which is one of our law firm members. And I want to thank, this has been a phenomenal conversation, and I want to thank first Representative Speier, who's no longer with us. Well, at the moment, she's still with us, but with the caucus right now. I want to thank our old friend, Assemblymember Phil Ting, for all that you do and your staff as well. Big shout out to Mark Checkelbane, can't forget him. And to Supervisor Ellenberg, to you and your staff, and the whole family of public employees, again, from
Pleasure.
us in the private sector, the Bay Area Council, and our 375 members. Thank you to you and all that you do on our behalf.
Thank you
so much. Stay safe, everybody, and stay home.
Yes, and also thank you for shouting out my staff. I know that I couldn't get anything done without them, so thank you, Matt. And thank you to you and all your members for all the great work that you all do.
Okay, thanks.
Echoing that.
So look out for next week's webinar, everyone. We'll see you same time next week with a hopefully as interesting and entertaining a subject matter. Bye.